how kidney transplants work done?
Kidney transplant has started in 1901 by a surgeon called Peter Ullman, and since then thousands and thousands of kidney transplants were done, and the techniques of transplant are actually slowly increasing day by day, thereby increasing the success rate of the kidney transplant. The basic principle why a kidney transplant is successful and could be done quite often is because a person has two kidneys, and even if you take out one kidney, nothing happens to that person called donor. Basically because two kidneys, they work only to 50% of their capacity, and if one of its fellow is removed, the remaining kidney doubles its function, so that there is no defect in the kidney function overall. If you see here in this image, the person has two kidneys, one kidney has been taken out for donating to somebody who is his blood relative, because there is something called tissue matching, that every person has HLA, that is human leukocyte antigen, on his white blood cells, and the degree of matching actually decides the long-term survival of a donor kidney or a transplanted kidney. If you see here, we actually don't take out the diseased kidneys. God has given us two kidneys. Due to some reason, if they fail, that person is called a kidney failure patient. He should go on hemodialysis every third day or every second day, depending on the intensity or the importance of his job. If you see here, the native kidneys are not touched upon in a kidney transplant. The donor kidney is kept in a different location. This is called ectopic location. So this is kept closer to bladder and on one side of the umbilicus. You can keep it either right side or left side. Once you keep this kidney is easy to monitor or to follow up or to investigate in case there is a problem, because scanning of this kidney, which is just under the muscles, is quite easy. Because this transplanted kidney is a precious kidney. Any problem, we should attend to it as urgently as possible. So a patient also will be made to understand where his kidney is in case there is any swelling, any pain, any fever or any edema or bloating in that area, he has to bring to our notice. Now, when a kidney is taken out from the donor, we keep it in ice cold saline, basically because the metabolism of the kidney should be kept as low as possible before it is transplanted to the recipient. So that takes about 30 minutes to 40 minutes or 1 hour. I am a left-handed surgeon. I do quite fast, and the fastest I have done a transplant is in 14 minutes. We have joined the artery and vein and reperfuse the kidney, and once you do that successfully, immediately the urine comes. The kidney becomes firm, turgid, and then puts out urine. Now, why and how we are giving the blood supply to kidney, which is in the iliac fossa or much below the normal level, normal position in the human body, is because we are sharing the blood flow from a vessel which takes the blood flow to the lower limb or the leg. So the vessel which supplies leg also supplies the transplanted kidney now, and nothing happens to either of them. It works wonderfully well, and you can see here, this is the reperfusion movement, the glorious movement of kidney transplant, where we are actually releasing the blood flow into the transplanted kidney, which is actually till now stored in actually ice cold saline. Now suddenly it comes to normal body temperature because of the perfusion. It works extremely well if the matching is good, and then puts out urine in seconds. And first few days, the urine output will be much more. It could be 10 liters, 15 liters, 20 liters, or we have seen 30 liters per day, because the person who is a kidney failure patient has a lot of extra water in his body. So that is being poured out by the new and fresh and dynamic energetic kidney what you have taken out from a healthy donor. She is a lady whom we have operated upon. She is a kidney donor, a young donor. She gave the kidney to her daughter who has suffered from kidney failure at the age of 18 years, and it is a successful transplant. It is 14 years from her transplant, and kidney function is excellent. Mother is also fine with a single kidney. Daughter is also fine with a single transplanted kidney. That goes to show how successful it is, depending on the degree of matching that exists between the donor and recipient. This lady, after about few years of transplant, she got married to this boy who was actually little hesitant, or was actually being forced by the relatives not to marry her because she is a kidney transplant recipient and her future is not very sure. We told him in practical terms that she might live an average 10 to 15 years because the matching is very good. Now she is 14 years since then. She gave birth to a child. They are happy, healthy, with creatinine kidney function of around 90 to 95% in the recent month. That goes to show kidney transplant person can go through a normal marriage, pregnancy, childbirth and child rearing. You can see here this lady I met in a marriage where she told that I operated on her 22 years back for a kidney transplant. After the transplant, she gave birth to a child and in that child's marriage we met accidentally. She told that this girl is healthy, has no kidney problems. They were staying abroad and hence she could not come often to my follow-up, and hence she reminded me that I did a successful surgery 22 years back, and she is enjoying the fruits of that surgery, kidney transplant. Now the donor shortage is very acute because out of 100 kidney failure patients, only 3 have suitable donors. 97% of them are just waiting miserably, desperately for a cadaver transplant or a living related donor, because many of relatives are little hesitant. They just run away when they come to know that they need to give the kidney, and hence artificial kidney is being actually proposed. It is being developed in the experimental labs. I am glad to share that these artificial kidneys made in the tissue labs is working successfully. It is in experimental stage, but it's not very far before we can make it available to the common man in general. If you see here, the artificial kidney is like a 2-chamber box which is of the size of a fist. It has 2 chambers. The first chamber is actually painted with the nanofiber particles. Here there are some nephrons. Every kidney failure patient has some functioning nephrons. Maybe around 5 to 10% of nephrons are still in his kidney. So we take out from the diseased kidneys a few nephrons, paint them onto this plate, and the nanofiber technology makes it possible to incorporate inside a chamber called filtration chamber. You can see here, these are the nanofibers which are painted onto that. Nano means 10 to the power of minus 9, which is very minute, but still can do the function of a kidney, which is very, very unique in its function. You can see here, this is artificial kidney, also called bioartificial kidney. The first chamber is a filtration chamber where the nephrons of the native person are painted here. So when the blood flow enters the first chamber, it actually filters all the dirty material out and then comes to the second chamber. Second chamber is called reabsorption chamber, where any useful particles, if they are filtered out, can be taken back, so that the body does not lose precious electrolytes, proteins, or whatever important things. So these 2 chambers together can make an artificial kidney or a bioartificial kidney. The surgical technique for an artificial kidney transplant is same as the normal kidney transplant. Hence we as surgeons need not have any extra training for doing an artificial kidney transplant. There are occasions where we have got trained in USA, London, and even Switzerland, Australia. The experiments are going on where bioartificial kidneys are being transplanted to many people, willing volunteers, where we really tell them that we don't know how far it works, but still the technique is quite good. The artificial kidneys are very successful in their whatever longevity, and we have seen the success of up to 5 to 7 years of these bioartificial kidneys, and they would come when persons actually living related donors or cadaver donors may not be necessary, that everybody would be transplanted with a tissue generated artificial kidney made in the labs, and that should be the universal availability of the donors compared to what actually 3% donors have, the 3% of transplant patients have the donors, whereas once the artificial kidney comes into vogue, comes into practice, then maybe living related donors may not be necessary, and all these kidney racket, all the unethical practices of kidney transplant done with unknown persons will be eradicated, and that's the day all our surgical community would welcome. All the nephrologists, all the technicians, all the experts involved in the kidney transplant would actually look forward to that, so that we can transplant to every needy person who is having kidney failure, so that these artificial kidneys do not have any problem of rejection or any unnecessary burden of immunosuppressive drugs, which also need to be taken lifelong, and they are quite expensive to the core. And hence artificial kidney is going to be a reality in near future. We all look forward to that, and that would be a great achievement for the society in our generation. Thank you.